Hello, everyone. It's week 7 since the state implemented a stay-at-home advisory. Last week, Governor Baker announced that all schools will be closed for the remainder of this year. He recently announced an executive order closing all non-emergency child care programs until June 29th, and that his stay-at-home advisory and non-essential business closures will remain in effect, until May 18th. He has also extended the state's order banning gatherings of more than 10 people. HMEA's site-based programs support groups of 10 to 100 people in any one site at any one time. With that said, I believe it's safe to assume that our day programs and other site-based services will probably remain closed until the end of June. HMEA's executive team is already thinking ahead and will continue to work closely with government entities and state officials to plan for the safe and measured openings of our programs when the time comes. Right now, we remain laser focused on the health and safety of the people who live in our homes and the staff who support them. This week was the first week where we moved toward a live-in staffing model where staff are staying for 1 to 2 week periods in the homes. We are optimistic that this strategy will help contain and limit the spread of the virus. Many thanks to the staff who are able and willing to participate in this model. This past week and a half has been rather difficult. We have had 3 more people we support show signs of presumptive COVID-19 and 5 who tested positive, as well as 4 employees who tested positive. These people are isolating within their homes and following all the proper procedures and precautions outlined by the local Board of Health. As I mentioned a few weeks ago, we opened an isolation center in Millbury for the individuals we support residentially who are diagnosed with COVID-19 or they have a presumptive case but do not require hospitalization. To date, we have had 4 individuals supported in that center from 2 of our residential homes. I'm really happy to say that this week, the first person who was admitted to the center was discharged to his home. He was healthy and smiling as he left the building. Currently, we have 3 individuals being supported at the center. I want to take a moment to acknowledge the staff who have volunteered to work at the center. They have put aside their own anxieties to help nurse and support the people who were admitted to the center. I'd like to list the names of the staff, the center staff. Julius Jokin was the first support staff to work at the center. We thank you very much. There's Mark Fenter, Michelle Sheldrick, Crystal Cole, Jasmine Cooper, Michelle Richards, Tom Campbell, Danielle Warner, Rebecca Devine, Phyllis Scoof, Diane Matson, Jamie Hernandez, and Fran Trombowitz. We greatly appreciate your selflessness in the service of others. In other words, in the face of these scary times, you put the needs of others first. You truly are HMEA heroes. There are also a few other people I'd like to mention that are connected to the center in other ways. They worked to develop all the details needed to create and operate the center. A huge shout out goes to Peggy Caldwell, Rebecca Devine, Stephanie Guittard, Ron Bonds, Michelle Bellaros, and Brenda Sibian, to name a few. I apologize in advance to anyone I failed to mention here today. Overall, it took the combined effort of the HMEA Village to pull the isolation center together, and it was done expertly. This week, our Human Resources Department sent out an updated frequently asked questions sheet, an FAQ sheet, which provides a great deal of information for all of you. Please check your HMEA email for a copy, or you will find it included in the scoop on ADP by late Friday this week or early Saturday morning. I forgot to mention that the state continues to coordinate pop-up testing sites available to all our support staff with no cost to you. Unfortunately, we are not always able to provide a lot of advance notice when they pop up. But as soon as we've confirmed a site, a date, and time that's available for testing, we'll make sure to share the information with you. I want to start wrapping up by saying we are embarking on May. May is right around the corner, and May is Mental Health Month. During this crisis, many people are struggling with anger, loneliness, depression, fear, and unfortunately, some are coping with the effects of a loved one, or you yourself have been diagnosed with COVID-19. No one should feel ashamed of these feelings. It's a tough time for all of us, and many, many, many people need help now more than ever. Please remember that we have an employee assistance program that you or anyone in your household can contact for assistance in many areas. The number for our employee assistance program is 800-648-9557. And all calls are completely confidential. It's between you and who you are talking to on the other line. If you or someone you know or work with needs assistance, please share this number with them. I want to end by saying that this crisis has affected everyone at HMEA, everyone in the state, our country, and around the world. It has challenged all of us in ways that most of us never could have imagined. Yet, what I see when I look around HMEA is compassion, hope, and innovation as we think about the future. As you care for others, take some time to care for yourself. I do believe we will get through this together. We are HMEA. Thank you.